So far in this series, the dead have been the subject, the dead doctor, the dead medical assistant. But the dead are only the visible part. For every Preston Phillips, there are 10 clinicians who have been threatened. For every Todd Graham, there is a Las Vegas and a Great Falls and 1,000 near misses that never made the national news. This is the episode about the ones who survived. On the afternoon of June 29th, 2017, Chad Broderick walked into the Center for Wellness and Pain Care in Las Vegas. He asked for a same-day unscheduled appointment. He was a regular patient there. He had chronic back pain. He was, according to his neighbors, a longtime firearms enthusiast with a concealed carry permit and at least 5 guns at home. The clinic told him they could not see him that day. He left the counter. He walked into the waiting room, and in that precise moment, he opened fire. I've never heard something that loud in my life. He pointed the gun at me and I just ran. Chad Broderick wounded 2 clinic employees and injured a 3rd person who fell trying to escape. None of those injuries was fatal. He then turned the gun on himself. A bystander told CBS News, "It's really shocking how people could do something like that. For something so small." The thing so small was access to a doctor's appointment. 2 months before Las Vegas, in April of 2017, in Great Falls, Montana, a chronic pain patient drove to the home of his physician. The physician had recently declined to continue his opioid medication. The patient set the doctor's house on fire. He held the doctor's wife at gunpoint. He took her hostage. Police were called. A standoff followed. Eventually, the patient turned the gun on himself in the burning rubble of the doctor's home. While officers waited at the perimeter, the doctor's wife survived. The doctor survived. The physician went back to seeing patients. The story disappeared. I want you to sit with the timeline. In April of 2017, a Montana patient burned down his doctor's house. In June, a Las Vegas patient shot up his pain clinic. 5 years later, in 2022, my friend Preston Phillips walked into work, and 4 people died, including him. 8 months after that, in 2023, Benjamin Mock sat down in an exam room, and he died. The pattern was visible. The pattern is still visible. The pattern is still continuing. The pattern was visible. The pattern is still visible. The pattern is still continuing. In 2019, the American Academy of Pain Medicine surveyed its own members. They wanted to know whether what they were seeing was as bad as it felt. The survey came back. 67% of responding members said a patient had threatened them physically at least once a year. Roughly half had been threatened specifically over their management of opioids. 8.9%, nearly 1 in 10, said a patient had actually physically attacked them. Imagine if almost 1 in 10 of any other profession were being physically attacked. Imagine if 1 in 10 school teachers. Imagine if 1 in 10 plumbers or cab drivers. Pain physicians are being attacked at that rate, and the policy response has been, what exactly? A survey. A few academic articles. That is not a policy response. That is a chronicle. In each of the clinic shootings in this series, there were survivors. People who happened to be in the wrong examination room at the wrong moment. 2 clinic employees in Las Vegas. 4 Alena Health employees in Buffalo. A doctor's wife in Great Falls. The 2 witnesses in the parking lot. These people are not abstract. They went back to work, in some cases to the same waiting rooms. They needed the paycheck. That is what surviving a near miss looks like. Dr. Brandon Zabukovich, a colleague of Todd Graham's, said something to Stat News. I have had knives pulled on me over narcotic prescriptions. Read that sentence twice. There's not a lot of argument. He means, my patients do not pull knives on me anymore, because I do not have the conversations that would have caused them to. That is not pain management. That is stepping out of the way. Multiply that. Doctors who no longer have the conversation. Patients whose pain is now somebody else's problem. Usually a pain clinic with a waiting list. Sometimes one that does not exist. Nobody would be surprised to hear that a pain medicine physician was killed. That is a sentence to sit with. Published in Medscape in 2017. If a sentence like that came out of any other profession, nobody would be surprised to hear that an accountant had been killed. We would consider it a national emergency. In 2017, it was a passing remark, and it was true. So this is what I want you to hold in mind as we go into the final episode. The dead are not the whole story. The dead are the visible part. The wounded are the rest. The thousands of physicians who have been threatened. The clinic staff who have absorbed the abuse. The families that moved when threats followed them home. They have been doing this for years. We owe them the policy that would let them do their job without fearing for their lives. Almost 1 in 10 is being attacked. That is not a personal problem. That is a national one. One question. In your state, does workplace violence in healthcare get tracked? Is there a reporting requirement? Is there a fund for de-escalation training or basic security? If the answer is no, and in most states it is, then the dead in this series are not the end of the list. They are the visible part of a list still being written.